Today I'll be talking a little bit about agenda setting for cognitive and behavioral modalities. CBT is meant to target clients' problems in a focused way and is likely to last somewhere between 6 and 20 sessions, depending on the client's severity or coexisting personality disorder. Within the first session, it's important that the therapist starts to develop an alliance with the client. And then in the following 2 or 3 sessions, they can focus on assessment. They could start developing an initial formulation. And this is a really important step as both parties need to be clear about the exact nature of the problem, at the same time growing the working alliance and encouraging the client to participate actively. The next session focuses on trying to tackle the client's problems and to evaluate things from previous sessions that worked and what didn't work, and see the maintaining cycles. That could be very helpful in terms of which intervention to use and apply new ones as needed. So the setting of a mutually agreed upon agenda at the beginning of each session is a key feature of CBT. Without further ado, I want to talk about the 7 agenda items identified in Kennerly, Kirk, and Westbrook's Cognitive Behavioral Therapy, Skills and Applications. The first order of business in setting an agenda is to do a brief review of the events from the past week with the client. When asking the client to summarize which events or situations have been happening, it would be quite nice to give them enough time to answer the question while not going into major detail. After all, you're getting a brief overview. So after getting a response, it is important to acknowledge their concerns and their feelings, and how all of these issues do contribute to the client's overall presentation. And you want to validate some of those feelings, thoughts, or behaviors that they've been experiencing, while at the same time trying to maybe offer to put these maladaptive ideas onto the agenda. The second step is to review what was discussed in the last session. This can include an expansion on the points made or gather what the client has realized since the previous session. The third step is to assess the client's current mood by using a standardized measure like the BDI, for example, Brecht's Depression Inventory Questionnaire, or a more informal scale through questioning, asking things like, how has your mood been since the last session? Does any aspect of it need to be addressed over the course of the session? So it might be helpful to ask the client to rate their mood using a scale that is the same from week to week. For example, they could use the scale of, for depression, they could say, how has your mood been over the past week from 0 to 10? Where 0 is at its lowest, no motivation, really low mood, and 10 being at the absolute highest, fine, no problems at all. And the same goes for an anxious person, but it could be the reverse scale, where 10 is absolutely worst anxiety and 0 being not anxious. And the fourth step is to review what are some of the things that you learned from the last session. But it's important to also not use words that might have a negative association. So instead of using the word homework, you could use the word self-survey, which could be referring to their coping style, or evaluation of biases. So these are just sort of examples to talk about identifying negative automatic thoughts and the resulting feelings without using the word homework items. But homework items are particularly useful in cognitive behavioral therapy, and they align well with the time-limited nature and the structure of CBT by keeping clients focused on the treatment and to know whether the client really requires further treatment down the line. Since most problems are based outside of the clinic, the assignment really brings out what the client learned in the session into generalized practice. So goal setting implies a collaborative effort to change certain patterns that are occurring where the client may not even see change as possible. And it does instill some sort of hope and reduce their anxiety, so it should definitely be addressed in the beginning of a session. So the fifth step is to identify the main topics for discussion, such as their symptoms, which are internal, or issues in different domains, which are external. So there's a whole host of potential answers here of addressing different negative automatic thoughts that the client is experiencing, or they have identified one or two major concerns. Let's say, for example, that a client comes in because they experienced a breakup with their long-term partner. You might ask, how does your recent breakup affect your day-to-day? Here, it is important to let the client really evaluate which concern they might want to focus on in the session, depending on what is most pressing for them. So when deciding what to prioritize, it's important to consider different issues of risk to the client, including potential risks to their children or urgent problems, as well as their level of distress. So targeting things that are at the top of their list. The centrality to the original formulation that was made to achieve certain goals, issues that are useful in therapy and that can be addressed within therapy. So in the early stages, it's not usually helpful to tackle highly distressing and complex problems because the client does not have the skills or abilities to deal with them yet. So similarly, issues directly related to rigid held beliefs should be avoided. And however, you can balance this against the current issues in the client's life. So putting on the agenda only the items that are prioritized and mutually agreed upon, as I mentioned, and considering roughly how much time needs to be spent on that during the session. So after the bulk of the session is carried out, there should be around 10 minutes left to give homework. And, in the agenda setting, it's important to mention that there will be some form of task or assignment to complete, and also ask if the client has any feedback. In this time, the therapist can ascertain critical information on whether the client seems to be giving honest feedback or if there's just sort of tailoring their advice to be seen in more favorable light. So those were the last two agenda items. Let's evaluate the first example of agenda setting and establish some things that were done well. Dr. Grande started off by asking the client how they're doing now and how they've been doing in the past few days. So he unfortunately missed an opportunity to actively engage with the client by not asking follow-up questions. Starting with how the client's mood has changed from the previous session can truly indicate whether progression has been made. Remember that referring to the client's mood can be different based on the mental health concern, and in this case, he didn't ask on a scale of 1 to 10 or 0 to 10. So he just got a general idea about how she's doing. Otherwise, he continued to gather input about the homework and whether the client completed it. So that targeted one of the specific goals of behaving herself at work. So he listened very carefully as the client brought up several concerns. He then allowed them to pause and consider the three concerns mentioned. And, those three concerns were really about school, relationships, and being less argumentative. And this put the emphasis on tackling a major concern. So he did reciprocate each issue as important, but it was evident that he delegated some issues to the parking lot of emotions. And this technique helped validate the client's pain about numerous issues, but to really continue narrowing down on one single objective to stay within her emotional capacity. So although the client had not directly expressed which emotions, she was feeling, it seemed that each problem had its own associated feelings, making it difficult to focus on one in particular. So Dr. Grande forewent mentioning agenda item number 2, which involves reviewing the last session. This can be justified if he feels that the focus should be on strengthening the therapeutic relationship. And I believe that was a good move to make, that he didn't go ahead and just talk about a last session, as the client had a lot going on. As an alternative, he articulated the third agenda item by asking which concern consciously affects her functioning, otherwise known as her current behaviors, and the accompanying moods. I noticed that Dr. Grande gave authority to the client and full control by letting her select the most appropriate concern, which set the scene to work on her her specific goals. And by paying close attention, I also noticed Dr. Grande did mention how him and the client would put the goals into action through a cognitive model and reduce the symptoms, such as addressing those automatic thoughts and offering to design behavioral strategies to test elements of the cognitive formulation. He asked for feedback on the agenda as well, so that's sort of giving informed consent, the opportunity to accept it or not. What he did helped put the client in the driver's seat and also talk about the thoughts that were originally present, or offer the alternative of discussing thoughts that reflect her current situation. Now, I will talk about the second video where I felt that there was a large difference in the quality of setting an agenda. So the therapist started off the session by stating that the client's depression score from the BDI, which the client had completed in the previous session, was in mid-range of depression. So that particular way of starting the session, I did not agree with. So the issue was really the approach. It neglected to ask about the events in the client's present circumstances, which could be contributing to his mood. And he asked about symptoms being better or worse. And this was quite black and white. It didn't prioritize the main topic for the agenda. And the item of feedback was not really identified as a point of discussion to be had in the end of the session, but rather it seemed to be used to initiate dialogue about the previous session. Overall, they identified a topic for discussion, though it wasn't very specific. So the topic they identified was the low points that the client is experiencing and how those low points would relate to his thoughts. And I couldn't help but think that this was quite vague, as he didn't ask the client to describe the low points in terms of feelings or symptoms, or describing the external problems like relational conflicts or issues in performing a task. It really was a ambiguous topic that was not very indicative of the client's current situation. And I think it was important to draw attention to the client's point of view. The counselor was really more suggestive about using a behavioral activation technique without establishing this topic in the first place. So he did appropriately reserve the agenda item that he wanted to work on with the client for last, which was behavioral activation. But the way in which he delivered the suggestion applied that he had expert knowledge on what would work. Instead of saying, what I would like to work on towards the end of the session, he could have framed it in a different way that puts the client in the driver's seat, such as, let's see how the session goes, and if you're feeling like trying an exercise, we can talk about behavioral activation or activity scheduling to target this topic. It was an important opportunity to also mention that he'll be gathering feedback on how the session went, and that he would leave a few minutes at the end to either talk about his other concerns, discuss the appropriateness of the homework assignment, and acknowledge what the client found useful, which could spark ideas for future growth in the next session. I believe he did not follow up on, why the assignment would be useful. So now talking a little bit about the approach that I liked better, I would say I definitely lined up more with Dr. Grande's approach in agenda setting, as it had several more positive merits on the client. He was explicit with each and every agenda item. So the order and the pacing of the questions were really well timed, and he prioritized one single topic, which was very specific and meaningful to the client. The other counselor's approach seemed quite systematic and demonstrated that the agenda items that were on a whiteboard would be, interesting for the client. However, the client didn't organize the ideas. He started by talking about the client's results on the BDI and mentioned that he had mid-level depression, which had no context or minimal context around the usefulness of these scores. And bringing this up so early in the process can lead to a client feeling that the counselor is insensitive It was evident that the session was meant to demonstrate the agenda setting process in the early stages of therapy, but I found that his style was more authoritarian, and I thought it would be better if this counselor framed it more around the client's unique challenges rather than the depression alone. Again, not following up on the BDI's purpose or what it showed, may have not acknowledged or reassured the small improvements that were made from the previous session, as the client reported feeling at a 5, then to a 6 the following week. So my speculation is that the client may have struggled to identify a specific area that would please the therapist. And this counselor mirrored some of the things that the client was saying when reviewing progress from the last week, but he did not ask for further details about how the client applied what he learned. So one of the questions he did say was, "Are there any problems you would like to discuss today?" So I personally don't align with this. Not only does it fail to address the main topic, but this question was not constructive. It simply implied that the depression he was facing was problematic instead of acknowledging the intersection of multiple external factors or internal factors that go along with his thoughts and contribute to his feelings. I believe that the client would have provided more information about his issue had it been an open-ended question. Overall, he may have improved by asking questions that followed up on the client's confession about not having any thoughts, by urging him to walk through a situation where his mood was low and the contributing factors that went along with it. So in contrast, Dr. Grande identified and summarized all of the challenges that his client was experiencing, and then asked them to choose the topic they felt was most important to prioritize. So this created a collaborative environment and accomplished the goal of setting a structured agenda, leaving no room for misunderstanding, and the meaning of the client's issue was very clear. My approach would be more sincere and curious and non-ambiguous. I'd be inclined to start off the conversation in a more objective focus. So like Dr. Grande, I would welcome the client and ensure that they feel safe in each session by orienting towards them in an eye level and engage in eye contact and open body language. I would also minimize the use of props and just use my notepad or a sheet to keep track of the client's concerns while we're setting the agenda. I would allow them to pause and also show that I'm non-judgmental if they're experiencing multiple issues, as that's normal and that happens in every person's life. This can help structure the session, avoids dealing with issues prematurely, and identifies a clear objective right from the beginning. By keeping a clear focus on the client's specific challenges in the context of their life, I can minimize the counter-transference and giving personal experience on how to tackle an issue. So, as mentioned, the counselor from Qualia was almost too focused on an objective that he paid less attention to responding intuitively as the client expressed his mood. Perhaps the type of client does play a role as well. Some clients may have difficulty expressing their emotions, or depressed clients, as we know, might feel numb or disengaged from the therapeutic session. So I would be curious to see how the early stage encounters would go if the client and the counselor were at eye level and holding better eye contact. Perhaps the clients would have been more comfortable sharing the events and experiences, no matter how small or unimportant they seem. I also found that none of the counselors in this scenario circled back on some of the remarks made in previous sessions. This small piece of feedback could be very helpful in deciding what homework to assign the clients in the middle to end of the session. Now, I'll be talking a little bit about some of the common difficulties that new counseling students face in agenda setting and CBT. So some issues could be not prioritizing items to consider. So say a client lists multiple challenges that occur at the same time. While it can be easy to get caught up in the spiral of emotions and jumping from topic to topic, it would not be wise to tackle the highly distressing topics or core beliefs first, as the client may not yet have the skills to deal with that. This should be carefully balanced with what issues are seen as important by the client and not which ones are seen as important by the counselor. It also could be the topics that are more imminent and affect current functioning. And being aware that CBT is meant to address cognitive and behavioral resources in the client's control, I would help to refocus the client and decide what's the most important issue that they would like to change. And I would also discuss the relevance by understanding its centrality to their formulation. So coming up with SMART goals can really go a long way in setting an agenda. Having those SMART goals can be something to look back on and have a target for in the session beyond just the client's wishes. So by identifying factors associated with low mood, for example, we need to identify what cognitions and behaviors they're exhibiting. And that can be done and addressed in therapy, but also addressed outside of therapy. So the client's behavior, if it's not in their control, cannot be measured. So the therapy is really about setting specific, measurable, achievable, realistic, and time-focused objectives, which hold the client accountable and can help them prioritize items in the beginning of the session. So tackling issues that are not on the agenda before discussing them is another issue. So once the agenda is set, we should aim to follow it. But I feel that maybe making explicit deviations from it is more important for the client. So certain moods or recent events can come up which might take up the entire session. So it's important to really address what's going on in the present situation by looking at the hierarchy of issues in therapy, from issues that are life-threatening, issues that intervene with therapy, or the impact of the issue on the quality of the client's life. So it asks very tailored questions to understand what's most important. Like Dr. Gandhi did, he asked, what would you prioritize? I might also ask, where is the easiest place to start? Or what is the client most willing to work on? The last difficulty would be misunderstanding the meaning of an issue for the client. So I feel that that can happen quite easily with different cultures and personal differences. So it's important that the counselor does listen actively and ask enough questions to clarify the issue, but also acknowledge that if there is a language or cultural difference, that the client can explain the situation better. So in negotiating misunderstandings, the counselors and clients are generating meanings by coming up with new definitions of the client's issue. At the same time, these differences many times are misunderstandings, but they are opportunities to move forward together. So by further searching for meanings that mutually fit both parties would be a great way to collaborate in a conversation using different meanings as a starting point for new ways forward. And that has been my review of agenda setting. Thank you so much for listening.